Okay, so simplifying lower limb rehabilitation and some IKN concepts. Okay, so moving into the first slide here, and we're trying to merge neuroscience principles with musculoskeletal rehab. We have, when a client comes into our gym or our office or our clinic, we can use two basic trains of thought when we're actually beginning to assess them. And we like to call these cognitively generated goals versus nervous system goals. Because when a client comes to see you, they have a cognitive experience. So they have a feeling of pain in a certain area. And they're coming to you for the pain, but also for the reason, for the way that pain makes them feel, right? And that feeling is unique to them. So you might have 10 people with knee pain, but one person with the knee pain is not able to walk up and down the stairs well. One person with the knee pain is not able to get in and out of their car well. The other person with the knee pain is not able to run 5 kilometers without pain. And so they all have very different cognitive experiences, right? And we need to respect those experiences and the fact that every one of those individuals has different goals, because that's going to alter our assessment and our rehab. But then, if we look at the nervous system's goals aren't necessarily the same as the cognitive experiences or the cognitively generated goals of the individual. Because when it comes to the nervous system's goals, the nervous system just thinks about protection. The nervous system only wants to keep your system well protected. And if it's not well protected, a protective response generated, for example, right? And the ultimate form of protection is in the form of pain. Right, let me just check to see if that PowerPoint's working okay. Perfect. So protection can come in many different forms, right? But what our goal at IKN is to step back and understand what are the built-in protective mechanisms that an individual already possesses to reduce stress acting on our system before the higher part of the brain have to step forward and say, hey, I need to express pain now. I need to express excessive tension now. Alter your behavior. Okay, so we want to try and prevent that from happening, because when it comes to any kind of pain experience, we know that pain doesn't have to occur when there's only tissue damage in place, right? But when pain is experienced in the absence of any kind of tissue damage or any kind of trauma, we know that it's just an expression of protection. So how can we step back and prove to the nervous system that we do in fact have the capacity to express those built-in protective properties? Okay, because when you look into any kind of movement control textbook or motor control textbook, you'll come across many different ways in which the central nervous system exploits the properties of the musculoskeletal system to be able to dampen stress on our body. Right, because it all comes back to how well is your body managing stress. And when stress exceeds a certain threshold, that's when the higher parts of the nervous system will have to step forward and say, hey, you need an extra bit of help, and here's some pain to help alter your behavior. Okay, so we need to reduce that sensitivity, you can say. All right, so as an example, if I'm going to pull my finger back into extension here, I'm probably going to start to feel a little bit of pain and discomfort before I actually cause any kind of tissue damage there. So I'm pulling, and then I'm pulling quite far, and all of a sudden, my cognitive part of my brain, the conscious part, has to step forward and say, hey, what are you doing that for? I need to stop this. So it sends pain to make sure that you don't get to the point where you cause any tissue damage, right? And so a lot of what we're seeing when it comes to lower limb rehabilitation is the need for excessive protection. Okay, and so we need to ask ourselves, what are the essential things that need to happen for that lower limb to be robust and to dampen stress well on its own? And when I say dampen stress, I'm talking about from a perspective of how can I get all the tissues, all the structures and systems throughout the lower limb well able to reduce stress or dissipate stress well throughout the lower limb before the higher parts of my brain have to step forward and express things like pain or express things like excessive tone. Because tone and tension is one of the main ways that your nervous system will communicate with your body, right, in the absence of any kind of trauma, or if you were immobilized for an extended period of time. So that's one important point. And when it comes to movement in the real world, if we step back and look at the function of the entire lower limb, what is the function of the lower limb as a whole, okay, in a way that expresses the most true movement behavior of humans, which is gait, which is walking. And during gait, what we can see is that the lower limb acts as a platform upon which to decelerate the movement of your upper body mass, right? And specifically your head, your arms, and your trunk. Okay, and your head, your arms, and your trunk, some people refer to it as the hat segment, that makes up 2/3 of your body mass. So that's a lot of mass for your lower limb to be able to control and decelerate as you're moving in the real world, right? So we have to consider that, okay? And that comes down to managing gravity, because when we speak about managing stress on the body, we have to ask ourselves, what is the most consistent form of stress? And the most consistent stressor on our body is gravity. Gravity is always trying to pull you down towards the floor to make you fall. And so when it comes to movement in the real world, it's about making sure the lower limb can manage the movement and the gravitational force pulling your upper body down towards the floor. Okay, so that requires us to look at the reflexive properties throughout the lower limb to be able to act as a reflexive platform to allow for nice smooth movement and deceleration of the midline of my body, the head, the arms, and the trunk. Because when that lower limb is not doing a good job doing that, typically what you're going to see is the upper body has to express more of a trunk stiffening strategy, where you see a lot of tension throughout the posterior spine, a lot of tension on the lower back, because now the nervous system knows that the lower limb has lost that ability to do its job. And so now we have to kind of protect the midline, the spine of the body. So even with any kind of spinal and midline based issue, lower back pain, hip pain, we have to look at the lower limb's ability to dampen stress, because what's the first part of your body that interacts with the world during upright ground-based activity? And that's your foot, okay? And so it all comes back to the foot when it comes to lower limb rehabilitation. We have to understand, how is the foot responding to essentially what's a collision with the ground when you walk. When your foot hits the ground, it has to manage a lot of forces acting on it. And so we need to make sure that all those components and those tissues throughout the lower limb are doing a good job at dampening that stress and sharing that stress throughout all the tissues and structures before the lower back has a chance to tighten up, right? And if the lower limb's not doing a good job, then you can see certain areas around the lower limb express pain, for example. So as an example, let's say someone has anterior knee pain, okay? And we know that there's a pain experience there, okay? And it came on gradually. There was no pinpointed at a time when they fell on their knee, for example, or when they had some kind of trauma, but it came on gradually. We need to shift our thinking to say, okay, maybe that area is taking too much stress. Maybe that's accepting all the load. So how can we share the load? Maybe the outside needs a bit more load. Maybe the inside needs a bit more load. Maybe the back needs a bit more load. The posterior part of the limb needs a bit more load to share that stress over a greater surface area. So I just want to get you thinking about, if there's a pain experience in a certain area, maybe that area is doing too much. Maybe that area is the area that's tolerating or accepting all that stress that's acting on the body. And we need to step back and look at the things that need to happen to allow that stress to dampen, or allow that stress to be dampened well. So let's look at the idea between proprioceptive and preflexive or reflexive control. All right, when and why are they important? So with proprioceptive feedback, that's feedback from the body that we can, when we're moving very, very slowly in a very controlled environment, where we can wait for the feedback, right? In the sense that when your foot hits the ground, if I had to wait for the proprioceptive feedback to go all the way up to my brain, for my brain to process that and then to generate a response, that would be very, very slow. And that wouldn't allow my tissues around, the muscles and all the tissues around my lower limb, to respond fast to dampen stress. So I'd probably end up on the ground if I had to wait for the feedback. And that's why we have preflexive or reflexive mechanisms throughout the lower limb to act quickly to dampen stress. And what you're going to see very often, or what we see very often, is an inability to take advantage of those preflexive or reflexive control mechanisms. Okay, so the key point so far is that we need to look at how the lower limb is managing the head, the arms, and the trunk. We need to look at how well the foot is interacting with the ground in a sense that it provides a good platform for these reflexive properties to be stimulated, you can say, to turn on, you can say, to kickstart that process of dampening stress in our body. And then we need to look at, obviously, the reflexive control as well. All right, and there's many things that show how our anatomy has evolved over time to allow for this to happen. For example, if you look at the human body, an awful lot of the muscle mass is distributed more proximally. So I've got a lot more muscle mass around my proximal segments, around my hips and my thighs. But as you move from proximal to distal, what do you see? You see a lot more tendinous tissues, a lot more passive tissues, right? And you see less muscle mass. Okay, and why do you think that's occurring there? Is it because those passive tissues are designed to store energy, to be able to cooperate and share stress across many neighboring tissues, to dampen stress on our tissues, essentially, to help out when it comes to movement. Okay, and that makes it efficient. Like, imagine walking around if you had a lot of muscle mass around your foot. If you had really big muscles around your foot, it just wouldn't really work well. It wouldn't make us very efficient when it comes to movement. And so looking to see how the anatomy is distributed throughout the lower limb can really point us in the direction of what needs to happen when the individual's moving out of our clinic. Are we asking ourselves the question, are we really preparing the client to be able to walk in the real world when they have to adapt to lots of unpredictable forces? Because there's no point making your movements very rigid in a clinic or gym if that's going to fall to pieces when you step outside into the real world. Okay, so we have to look at these properties that make your body robust and make the lower limb robust. And when I say robust, I mean it's harder for us to stress the lower limb, and that's what we want to achieve. So we want to look at these basic overarching properties, but also we want to be specific to the client's cognitively generated goals as well. So it's a way for us to connect this with this. And if we can connect the cognitive experiences of the client, like if they are having pain around the knee, yes, we do some local work and we teach them specific strategies to change that. But we also need to step back and understand what are the basic things that need to happen for that limb to be robust in the real world. Okay. So key lower limb principles here. All right. Force production versus force deceleration. We need to think about this. So because gravity is always acting on our body and always pulling us down, most of our movement in the real world is actually involved to decelerate stress or decelerate our body. We're trying to prevent movement. We're trying to resist gravity pulling us down. Okay. And so we need to be able to decelerate forces acting on our lower limb before we produce force. Okay. Because your nervous system isn't going to feel comfortable giving you any kind of strength until it knows that it has a good exit strategy, we would say, before it knows that you can handle the stresses acting on your body. All right. And so that has energy cost principles attached to it as well. Because when we're producing force, let's kind of split it up into concentric versus eccentric contractions, right? So when you're producing force in a concentric manner, that actually lowers the feedback to your nervous system, in the sense that the muscle spindles that deliver feedback about the position of your lower limb in space become reduced, because it becomes more of a centrally driven thing. If I'm producing force, I'm thinking about what I'm doing. I'm really thinking about pushing through the ground. Like, think of a power lifter coming up out of a squat when they're producing force into the ground, right? Whereas when I'm walking, for example, I'm not necessarily thinking about producing a lot of force, because when my foot hits the ground, I'm decelerating the force of gravity, the force of my head, my arms, my trunk acting on my lower limb. Okay, so I'm decelerating forces, and then through the tissues, those passive structures around the foot and the ankle complex. Like, think of the long tendons that you see in your lower limb versus the midline. You have these nice long hamstrings, long muscles, long hamstring tendons, along Achilles tendon, lots of other passive tissues throughout the lower limb. You don't really see an awful lot of that, those long tendons in the midline. And that tells you that the lower body utilizes these tissues to be able to store energy and recycle that as you propel forward. So even as you're walking forward and you're rolling from your heel to your forefoot to propel yourself forward, you're not really consciously thinking about pushing or concentrically contracting, right, or producing force into the ground, but it's the recycling of energy to propel yourself forward. Because imagine if you had to think about producing a concentric contraction every time you propelled yourself forward. It would be massively draining, right? And what the research tells us is that eccentric versus isometric activities cost much less energy than it does to produce a concentric contraction, a shortening, because you're doing more positive work when it comes to concentric contraction. And so when we do an awful lot of lower limb rehab interventions, we're focusing a lot more on isometric activities first, in a way that takes advantage of all the segments. And you can break it down into very simple strategies that create an awful lot of change when it comes to taking advantage of these long muscles, long tendons, and the feedback from the foot. Okay, so it's really important to understand that we need to decelerate force using certain rehabilitation interventions before we start to produce force. Okay, because our body is not going to feel comfortable producing force until it knows that we can decelerate forces. Okay, and we spoke about the hat segment deceleration already. We need to make sure the lower limb is very robust to reduce those midline stiffening strategies. Okay, and so really when it comes down to it, when we go through an assessment, we want to identify the ability of these long muscles, these biarticular muscles. And when you look into the research around biarticular muscles, you see that they're designed to redirect forces. Okay, they're designed to redirect forces in a sense that allows our distal endpoint, our foot in this manner, because the foot is the first thing to contact and interact with the world around you. So I need these long muscles, I need these tendons to be able to dampen stress and redirect forces to keep me on track. So those are the things those are the key properties that we need to influence when it comes to any kind of lower limb issue, right? Because I would urge you to not get caught up when it comes to specific issues, right? If you have plantar fasciitis, if you've got an ankle sprain, if you've got knee pain, anterior knee pain, if you've got hip pain, yes, think about the local area, but also think about what needs to happen to make that lower limb robust. Because remember, if a lot of the pain that we're experiencing is just an expression of protection, if we can prove to the nervous system that we do have the ability to express those built-in protective qualities, and a lot of those built-in protective qualities is exploiting and taking advantage of those passive tissues, those tendinous forces and the biarticular tissues, then the pain serves no value anymore. Excessive tone serves no value, because we've just proved to the nervous system over a rehabilitative process, right, that we have the ability to protect the limb, because that's all the brain wants. It wants to know that it's constantly estimating the capabilities of your body to protect yourself. And when your brain makes an estimation to say, hey, I don't think that you can protect that lower limb anymore, so I'm going to express pain in the knee, in the foot, or the ankle, especially when it comes to pain that's kind of built up over time. Usually what you're going to find is that the individual can't express load or can't access these specific qualities when it comes to movement, right? So that's what I mean when it comes to muscular and joint dynamics, right? We have to look at the transfer of forces throughout the whole limb, all right? And again, your main biarticular muscles when it comes to the lower limb are going to be your gastrocnemius, right, your hamstrings, and your rectus femoris. All right, can they work together to transfer forces well, so that we can share stress over the limb, over a greater surface area, right? And what you're going to find that a lot of clients with lower limb pain, they can't do that, right? They rely on, they're trying to fight gravity, right? They sink into the motion. They can't decelerate load very well, so they show too much knee flexion when they're actually loading their leg, where the quad's being eccentrically loaded too much, and that might be kind of causing some protective tone around the knee, for example, right? So we need to use our assessments to identify these muscular and joint dynamics. And it becomes really, really simple, because then you're just looking at what are the big rocks that need to happen, what are the essential things that need to happen throughout that lower limb, and then how can I merge that with more local techniques. You do your mulligan techniques, you do other kind of local techniques in combination with this stuff. And we teach other local techniques too, but if you're only looking at the local area, many times you're not going to create that long-term change, because that client has to walk out of the clinic or gym into the real world and express these qualities to reduce the stress on the lower limb. Because if you look into any kind of research around how the nervous system controls the body, your nervous system is constantly receiving snapshots of the body on a moment-to-moment basis. All right, and so I would say that when it comes to lower limb rehab, many of us move too quickly into dynamic strategies. Okay, whereas we need to build good moment-to-moment control when it comes to the lower limb. All right, and that's why looking at specific isometric strategies is extremely important. But not just doing it like a hamstring isometric, not just doing a quadricep isometric, but how can we do an isometric activity through the foot to take advantage and to actually access these biarticular muscles? Because if you look at the image here, for example, we can describe the phases of gait using rockers. All right, so as your foot hits the ground, your heel is going to hit the ground first. So we call that the heel rocker, and then as your foot starts to decelerate towards the ground, then you get into the ankle rocker. And the ankle rocker is when that tibia starts to progress forward a bit. You start to pronate, because the pronation helps you decelerate the movement of your upper body. You need to pronate the foot, right, to decelerate motion. If you're always living in a supinated position of the foot, again, which is designed to be a rigid lever to help propel you forward, how can you decelerate motion? How can you dampen stress if you're in a position where you're trying to produce force? So using those different principles is important. But the most important part is that when we start to progress the ankle rocker to the forefoot rocker, we're progressing from the heel to the forefoot. That's when you're going to be typically suspended on one leg. And so that's when your whole head, your arms, and your trunk is suspended over your lower limb. And so the only thing that's helping you decelerate your head, your arms, and your trunk is your lower limb. And so what's important there is that we allow for, and you look into the research around what happens during gait, when you look into the research around how the lower limb muscles behave during gait, what you're going to find is that they all tend to function in an isometric manner, okay, because that's energy efficient. And when the tissues throughout the lower limb, especially those biarticular muscles, can function in an isometric manner, that allows the passive structures to actually move through the range of motion. So the tissues, the tendons, actually allow for the range of motion while the muscle acts in an isometric manner, okay? And so that tells you that the body already knows what needs to happen. We need to get those tissues functioning isometrically. Right, and that means that that's what's going to kickstart our rehab process. But in specific ways, we need to assess where does the individual need isometric load first. That's what's most important. But one of the things that might happen here is someone that is not expressing these properties throughout the lower limb is when they move from the heel to the ankle rocker, and then from the ankle rocker to the forefoot rocker. Is there responsiveness around the gastrocnemius to act isometrically? And many times you won't see that. Many times you'll see the gastrocnemius functioning in a concentric manner. And that may be why a lot of us get tight calves, because it's doing a lot of positive work all the time. It's producing concentrically. It's concentrically orientating itself to push you forward when it should function isometrically. Because when it functions isometrically, that's what helps us take advantage of the passive tissues. We're not able to take advantage of those passive tissues when we're producing force in a concentric manner, right? And you can see that in powerlifters. Powerlifters can lift a lot of weight from the ground, right? They can produce force concentrically to get that weight off the ground. 1,000 pounds on a barbell on their back, you can see it. But if you get that powerlifter to run a 100-meter sprint, they're probably not going to run very fast, because again, to sprint well, you need to be able to take advantage of these isometric qualities and these elastic structures, which are your tendons and your fascia and other passive components, to help you recycle energy to propel you forward. That's why, again, sprinters, they will train in a way that's more reactive, right? So we're almost trying to build up to that point. If you almost think about like any kind of clients, be it an elderly client or any kind of client with lower limb pain, if you think about, okay, what are the most robust humans that are able to express really good lower limb mechanics and robust features? And that's a sprinter. So if I can almost think about, okay, what do I need to do to get this client's lower limb functioning like a sprinter's limb? And then we can start to think of the rehab process we need to go through. We're not going to get them out on the track and start running sprints, but we have to think about, right, what things do they need to be able to express to be able to be a sprinter? We're not obviously not going to get them to be a sprinter, but if we can look at it from that angle, we can look at the essential things that need to happen throughout that lower limb to dampen stress, right? And you're going to see it again in sprinters. Their lower extremity muscles function in an isometric manner so that the tissues can take advantage of the passive properties to recycle energy, to store energy, and recycle it as you propel yourself forward because it's energy efficient. Okay? So hopefully that makes sense. We'll have time at the end to answer any questions with regards to this as well. So we need to focus on building better reflexive control, and that comes back to the preflexive qualities of the foot and the ankle first. It doesn't matter if you have hip pain, knee pain, foot pain, right? We still need to look at what the foot is doing in a way that allows it to dampen stress up through the chain. And so what you're going to see is that when people with pain, for example, are walking, when their foot hits the ground, their calcaneus hits the ground, and they progress from that heel to ankle rocker to forefoot rocker, they'll actually sink into dorsiflexion way too much. So they're sinking into dorsiflexion, and that's a reflection that they can't actually allow for the calf, the gastrocnemius, to function in an isometric manner. And that doesn't put the lower limb in a position to take advantage of the tissues isometrically, or also shift and share the stress to the passive tissues as well. Okay, so the responsiveness of the foot is extremely important. And we've worked with so many people with lower limb pain, from knee pain to hip pain. And once you can get that foot more responsive in a way where you direct your isometric load through the foot in specific ways to get better isometric activity through the entire lower limb, you will see a massive change in the amount of tone held throughout the hip, even around the lower back, around the knee. And then you merge that with more local strategies because you're looking at things from a global standpoint and from a local standpoint. Okay, so when we're talking about preflexive control properties, we're looking at, again, the responsiveness of those tissues, the mechanoreceptive responsiveness. Those tissues how quickly can they respond to when that foot hits the ground? That's the key, right? Because that's what's going to help set up an environment throughout that lower limb to dampen stress well. It's crucial for force dissipation, right? And it's crucial that we're responsive through that foot, especially when we start to engage the metatarsal heads. Am I sinking into dorsiflexion? Am I sinking into more hyperextension at the knee, which you'll see quite a bit? Doing that, I'm not actually taking advantage of these biarticular muscles. And we know that those biarticular muscles now are extremely important in transferring forces and reducing the forces acting on our limb. Okay? And so those are extremely important. These properties, the preflexive control properties, the biarticular tissues, taking advantage of the passive properties of the lower limb is such a low-hanging fruit, but it's not something that we do enough of. It's not something that we take advantage enough of when it comes to lower limb rehab, because we're always concerned about what are the small little details that need to happen, right? Do I need to do some short hard quads, or do I need to do some basic hamstring exercises? The thing is, like, you have to mimic real world movement to really try and establish long-term change and prepare the client for real world movement. And if you can look at things from a global perspective and see, right, doesn't matter where the pain is, I'm always thinking of these properties. Doesn't matter if it's anterior knee pain, posterior knee pain, medial knee pain, foot and ankle pain, metatarsalgia, plantar fasciitis, hip pain, any kind of issue at all. These are the properties that every human has to be able to express. Because you look at a human from the exterior, yes, we all move differently, we all have different behaviors, but beneath the surface, we all have very similar properties and mechanisms that allow us to move in a way that allows us to reduce the stress in our bodies in the real world. Because when you look at the difference between a clinical environment, it's very controlled, it's very relaxed, but once you step outside the door into the real world, that's when you're dealing with a lot of unpredictable forces, and that's when you need these properties to do their job. All right. So when it comes to the assessment basics, I think we'll go for another 10, maybe 15 minutes, and then we'll stop for questions. Just make sure that everything's going okay. Hopefully you can actually hear me, because I can't see myself talking now, so hopefully it's going okay. So from an assessment standpoint, what we talk about an awful lot is the client's ability to demonstrate a dynamic ankle strategy. Okay, can their ankle do the work before the hip has to do the work? Right, we've heard of this in neurological research where the client might have ankle strategies, hip strategies to respond to perturbations. And many times we do certain tests to assess the ability of the ankle to be responsive and be able to manage our body mass at the ankle on its own before the hip has to play a part. And what you see, especially in lower back pain for a second, we'll just jump to lower back pain, because even that's connected to the lower limb. You'll see that those individuals hang out on their heels an awful lot. They put a lot of pressure through their heels. So they don't want to go into the forefoot. And with that, again, that distribution of weight through the forefoot, we're losing the ability to take advantage of those biarticular muscles if we're hanging out on the heel all the time. All right. And then what happens then is they use what the research shows is that they use the lower back and the hip as a fulcrum. So the hip and the lower back are doing everything. So there's no wonder that we're getting an awful lot of tension and pain around the back or in the upper glutes and the piriformis area. It's no wonder that those areas are so sensitive, because they're doing all the work. So if we think about, okay, where do we shift the stress towards? What part of the body needs more load? And then that can act as a way to dissipate stress and share stress acting on our body. All right. So doing certain tests, and we do certain tests in standing. We do certain tests in a supine position to assess the ability of the ankle in every lower limb case to be able to dampen stress well, to see if that individual has the ability to take advantage of those biarticular tissues. And that can give you so much information when it comes to what you need to do at the beginning of rehab. All right. And it's not a case where this is the most important thing in the world, but this can make a huge difference in reducing stress. Okay, because this is what we would see as a big rock. Like, what are the big rocks that you need to put into the jar before you start to fill things in with tiny grains of sand to fill up the space? The big rocks are these biarticular muscles' ability to dampen stress, our ability to take advantage of the passive tissues throughout the lower limb, our ability to allow those tissues to operate in an isometric fashion, and the ability of stress to be shared throughout a greater surface area throughout the lower limb, before you start thinking about the minor little details. Like, are we missing a millimeter of movement at the calcaneus? Right? Are we missing a little bit of tibial rotation? Those things are important, obviously, but they need to be fed into the behavior of the entire limb. And so when we look at the whole body from an IKN perspective, we will look at the lower limb as a whole, the midline as a whole, and the upper limb as a whole, because we want to look at the behavior of the entire limb, and then we can merge that with the specific strategies that you might use. Mulligan, for example, you might use manual therapy, for example, at certain areas. But when you merge these two ideas together, that's when you can really facilitate much faster and long-term change when it comes to pain and movement issues. All right. Now, there is a well-known researcher called Paul Glaser, and he looks into the variability. He did a research study that looked into the variability and the importance of variability when it comes to lower limb rehabilitation. And what he found was that the position of the foot and ankle is extremely important in allowing for forces to be distributed well through the chain. Because when people sink into dorsiflexion too much, the talus is going to kind of butt up against the fibula. And when that happens, when it butts up against each other, there's less room for rotation. And the rotational properties of the ankle, the knee, and the hip is very important to allow for a dampening of perturbations, to allow for a dampening of stress. Because when you sink into too much dorsiflexion too, what you're going to see is the knee usually moves back into hyperextension. And when the knee is moving towards hyperextension, we lose that transverse rotation, right? But it all comes back to the foot and ankle, right? But this just shows us that, again, it's the behavior of the entire limb. And he looked at it actually in individuals with knee pain. And when you start to work through the foot using a very clear and simple framework, I know we're going to the principles now. These might be a lot of new principles for people to learn, but if you can set up a framework of assessment by looking at these principles, and then obviously having your more specific techniques, it can really create a much clearer idea of what you might need to do in your mind when it comes to any kind of lower limb rehabilitation approach. All right. And then what we want to progress towards is making sure that the lower limb is able to decelerate the midline of our body, the head, the arms, and the trunk. Right. So we want the lower limb. We progress from doing lots of isometric strategies, other dynamic strategies throughout the lower limb, and then our goal turns to, okay, how can we now allow the lower limb and the midline of the body to dissociate from each other using specific strategies with a foot and ankle as the kind of the main approach, as the main kind of the main rock in this rehabilitation approach, right? Because again, what happens, and this is something that's important as well, is that if you can't decelerate load well, just in the same way, if you sink into dorsiflexion, you move into too much hyperextension of the knee, the client has to have some way of moving your body weight over the stance limb as you're walking. So my right foot hits the ground, let's say. I'm moving from heel rocker to ankle rocker. My body's moving forward. Now, all of a sudden, I don't have the ability to engage the transverse arch, the metatarsal heads, to take advantage of the biarticular muscle of the gastrocnemius to dissipate load well. I sink into too much dorsiflexion. I'm moving back towards my rear foot, so I move into hyperextension. And so what does the individual do? They might tilt their pelvis anteriorly to try and get their body weight over their lower limb, because they have to progress forward in some way. And so what do we see? We might see a lot of tension and tone around the lower back. Okay, so looking at the lower limb at the lower limb from a behavioral standpoint is very important, but we also need to look at what's happening at the midline as well, oftentimes when it comes to lower limb rehabilitation, right? But a clear framework needs to be put in place. Okay, I've gone through an awful lot of things there. Now, I can appreciate that there's probably a lot of things that might be new for some people, but trust me, when you can take advantage of these properties, again, it really, really does simplify the rehab process. Because remember, going back to the introduction that I mentioned, is that we used to use these same properties and these same principles when it comes to prosthetic rehabilitation, and these are the essential things that need to be mimicked in the prosthetic limb. You need to have good responsiveness, some passive stiffness in the lower limb, because you don't want that individual sinking into the prosthetic limb and having to use their proximal tissues to do all the work. Because what you're going to get a lot of back pain in those kinds, and you're probably going to get a lot of pain around the residual limb, right? But we're looking at obviously things from a musculoskeletal standpoint, not in amputees, where we're looking at the principles that need to be kind of merged with lower limb rehabilitation. So any kind of musculoskeletal, foot, ankle, knee, hip, lower back issues even as well, like I said, is really, really important to look at these principles. All right. So what I think we can do, we've got 50 minutes left now. So Dr. Feig, what I'm going to do is I'm going to jump out of the PowerPoint. I'm going to come back into the screen share into this. Okay, let me see.
Do you want the screen share again?
Okay, no, I'm good now. Okay. Does anybody have any questions? Okay, we have a question. How can we find out if the gastrocnemius is contracting isometrically? Can it be done with observation, or is there any other way to do it? No, there is a way to do it. So there's a sort of a skill to it as well, because it's important to get to the client in a position. Like, let's say, for example, you have the client standing in your clinic. You need to get them into a position where they're engaging in between that heel and forefoot rocker. So they're in mid stance, let's say. All right. What you want to do is you want to get a little bit of a knee bend. Okay, so they're engaging their forefoot a little bit more. All right. Get like a 15 to 20 degree knee flexion. And then what you want to do is you want to reduce the pressure through the opposite foot. And with the foot that's in stance, the foot that you're actually assessing, you need to get a little bit of lift in the heel. So you're engaging more the forefoot, right? And then what you're going to see is that, let's say you want the client to put maybe 70, 80% of the weight through that stance leg. So the knee's slightly bent, the more the weight is in the forefoot, and then the other foot's just there for a little bit of support. What you're going to see is that a lot of the times the foot and ankle won't be able to be responsive in a way that keeps your body upright. And you can have them kind of have gentle contact against the wall as well for this, but you don't want them to use their hands too much. But you're seeing, can they use the responsiveness at the foot and ankle to keep their body upright, or do they start to use more of a hip strategy? And typically you'll see them use more of a hip strategy. So that tells me is that the individual doesn't have the ability to allow for that gastrocnemius responsiveness, to take advantage of those properties, because that's the preflexive response, those quick little responses at the foot and ankle to control our center of mass. Now, we have to consider that there are other things that might cause someone to maybe lose their balance there as well. And that's when we can start looking at other kind of top-down ways to influence the lower limb. Like the vestibular system might have a big impact on that as well, because that's going to help us manage gravity. But we would use that just for information. And it's hard to kind of to give you a specific step-by-step strategy over this platform as to how to specifically assess for that. But it's a really nice kind of global assessment to do at the very beginning, even when it comes to lower back pain. So we would use that same strategy I just described with any kind of lower back pain, hip pain, knee pain, foot or ankle pain, to see if the client has that ability to get that gastrocnemius contracting in an isometric fashion, because that's going to tell us that puts them in a better position to take advantage of these biarticular tissues. Because remember, like when you're moving during gait, there's a significant amount of time when you're standing on one leg, right? So it wouldn't make sense that we have to wait for the feedback from the body to generate a response. Let's say, for example, you're stepping off a curb and you roll your ankle. In that moment, you can't wait for the feedback from the ligaments and the peroneals. Let's say if you're going into a lateral ankle towards a lateral ankle sprain, let's say, or the ATFL, you can't wait for that feedback to the brain, for the brain to say, oh, the muscle's there. That's a huge time delay, and you're going to end up with a potential injury. So you need to train these mesibiatric contract properties to react in a preflexive manner. Okay, and so there's many tests to client from a manual standpoint as well, how we can look at the lower limb on its own, because when you're doing it in standing, you're looking at the midline as well, obviously. So we'd get the client in a supine position and actually test them through their foot, okay, to see how well their foot can maintain a position when we move in different directions. That gives us information about where we need to direct our load. So from that information, I have so much information as to what kind of strategies that I need to use now at the beginning of the rehab process to load their body and to take advantage of these properties. And it makes it so simple, because you always have clear information then. And even if you're struggling, because I can appreciate that when you have any kind of client coming to see you with lower limb issues, you might get stressed because you don't know what to look for. You're looking, oh Jesus, do they have enough tibial rotation? Do they have enough supination or pronation? Do they have enough, whatever it might be? But if you just step back and say, okay, there are certain things that need to happen for that lower limb to be able to manage stresses when they walk in the real world. And so then straight away, you've got things that you can work on that you know can have an influence, that you know can help, right? And that means that arises from looking at how the central nervous system exploits these properties. Because if your nervous system had to always be aware of what's happening in the lower limb, it would be hugely exhausting. It would be very energy inefficient. And that's why we have these properties throughout the lower limb that can do the work on their own without needing to send information back up to the brain and ask for a response. Or that's why they're called preflexive qualities. Preflexive, not even reflexive, but the preflexive qualities don't need to consult with the nervous system. The reflexive ones do, so the reflexes you get from your spinal cord, but there's also a time delay with those as well. So what we would do from an IKN perspective throughout a rehab process is that we would want to make sure that the clients can express these preflexive and reflexive qualities, but also we do some conscious-based work too. So we might do some specific manual work. We might do some more local work around the knee, around the ankle, around the hip, but we'd always kind of merge them together throughout the rehab process. So we'd always do a little bit of preflexive work, very specific isometric loading-based work, some manual therapy, but it's about the sequence that you do it in. The sequence is the most important thing, because I'm sure we can all appreciate now that there's probably not one exercise that's going to help everyone out there with knee pain. There's not one exercise that's going to help everyone out there with ankle pain. There's not one exercise that's going to help everyone out there with hip pain. Because if there was, you wouldn't be on this call right now, because you'd have all the answers. Nobody has all the answers. And so the sequence is important, respecting the cognitive experiences of the client, understanding what are the properties that need to be expressed for movement, and then merging that with some of the local and detailed work that you currently do. And that gives you much more of an influence over an individual's pain experience. It gives you a much better chance of changing that pain experience much faster, right? And in a way that just gives you lots more information about what you need to do. You'll never be stuck in a session, because you'll always have strategies that you can use, right? How does the eccentric contraction or asymmetric activity decrease energy expenditure? The way it works is that when you produce an isometric contraction or an eccentric contraction, right, it actually allows you, because there's lengthening that occurs with that. Because even with an isometric contraction, there's still activity happening during an isometric contraction. There's still length. There's something trying to lengthen your tissues. And so that lengthening allows you to actually share stress and share load to your tendons, to your passive tissues. And whenever you take advantage of the passive tissues, that's what's going to reduce energy expenditure, because now those tissues can actually help dampening the stress. Whereas with a concentric contraction, there's a shortening, right? If I'm concentrically orientated my bicep, I'm shortening it, right? So I'm reducing the need for any kind of feedback. I'm not putting any length into my tissues. So it's positive work, right? If you look into the neuroscience behind concentric contractions, it's positive work. So there's movement that needs to happen, right? Whereas with an isometric example is probably the least amount of energy expenditure that you're going to express when it comes to movement. And really, like I said, there's lots of research to show that the lower limbs do operate in an isometric manner, even though it doesn't look like it when we're watching someone walk. But what we're actually seeing is that the range of motion happens from the lengthening of the passive tissues, because it helps us recycle energy. And that recycling of energy means that we can be more energy efficient. Energy efficiency is important, especially when it comes to repetitive movement like gait, right? But it doesn't mean that we're never going to do any kind of concentric based interventions. We will typically move from specific isometric contractions, moving towards eccentric specific contractions and specific rehab interventions, and then move towards concentric. Because again, you have to decelerate force before you can produce force when it comes to real world movement, when you're interacting with the ground, right? You're not going to walk and produce force into the ground and fight the ground, but you're going to try and allow for compliance in the leg. You're trying, that's an important feature of these biarticular muscles in the tendon, is that allows for a compliant leg that's almost springy. We want a springy leg that can be nice and compliant, in the sense that we don't want a leg that has to fight the ground, fight gravity, because when it has to fight the ground, then that's very energy inefficient. That's when you're going to see a lot of concentric activity, and you're going to see a lot of high tone in certain tissues. You're going to see a lot of protective tone, particularly around the quads, which is an anti-gravity muscle. Can the client be taught to isometrically contract the gastrocs? Absolutely, because we would, the key importance of that is that you need to do that in a way that connects with the other biarticular muscles. So you see a lot of people doing isometric activities through their heels, for example, like if you're doing hamstring rehab. But one of the ways you can take advantage of the gastroc more is that you can actually do an isometric contraction through the metatarsal heads. So you're taking advantage of the gastrocnemius more. But it needs to be in the angles need to be right. When angles need to mimic the positions that you get into when it comes to gait. Okay, and we even need to look at other directions too. So always keep your mind in the foot. Like, how is the foot creating change and creating forces up through the lower limb, right? And so we always need to look at the foot interaction, right? And very often we kind of forget that when it comes to knee or any kind of hip issues or any kind of lower back issues. It's really important. So talking about the question from Learnable, talking about sequences in rehab, taking into account the autonomy of the patients, what kind of interventions would you prioritize for this preflexive control? Manual therapy, self-mobilizations, mobility, by Dr. Gonzalo. So from an intervention standpoint, like I said, we need to use isometric activities first, but it's not just any isometric activity. When it comes to movement and when it comes to like taking advantage of the nervous system, we have to understand that it's not the movement that's important, but the sensory information that you get from the movement. That's what's most important. And with real world movement, it's not about being strong, but it's about being able to estimate the right amount of force needed to carry out a particular task. So when I'm reaching for my bottle of water here, for example, right, I have to estimate how much force do I need to do that. So if I produce too much force, I'm going to have to change my pattern. If I produce too little force, I'm going to have to change my pattern. The same thing with the lower limb. When your foot hits the ground, it needs to be able to react very well in a way that allows it to respond, not just by being strong, but by estimating the right amount of force needed. And so when we're doing isometric interventions, we're building good force estimation capabilities. And so we're building tension very, very slowly using specific isometric strategies. I don't think, personally, I don't think you can do that. You can't take advantage of these biarticular tissues from using mobilization as manual therapy, because it doesn't put enough load into the body that mimics the real world. Now, you can do the loading first, the isometric loading, and then go back into your manual therapy. And that's what I mean by kind of incorporating what you currently do with this kind of work. All right. So you wouldn't just do this, but you would do it, you would merge it with your mobilizations, with your mobility work. And when you can do that, that's when you're going to make the most influential change, right? Because now you're looking at the big rocks, the essential things that need to happen, and you're going back and forth. So you're moving from preflexive based activities, looking at the biarticular tissues, right? Looking at the interaction between the communication between the tissues throughout the lower limb, right? And it really comes back to the assessment. You need to look at where they need load. It's not just that every single client needs to work the gastrocnemius, because that's one direction. So movement of the lower limb needs to be looked at from a directional standpoint, not necessarily as to what muscles need to fire, but when we move in certain directions, certain muscles will fire reflexively. So when you break things down into directions, it becomes much easier. Because think about it. Think about how many muscles cross the knee. 13, 14 muscles cross the knee. Is it easier to understand the action of all these muscles, or is it easier to understand the direction of movement capable at the knee, which is 4 directions: flexion, extension, medial and lateral rotation of the tibia? If you can understand directions, then you can get the person into positions where it calls upon those muscles to do their job reflexively. So I'd say I wouldn't get caught up in the actions of muscles, because once you engage positions through an isometric loading standpoint, the muscles will come on for you. Now, obviously, they might be slow to come on, and someone that hasn't engaged that, but at least now you have a good starting point and you know what to work with. All right. So I would say you need isometric loading. You need specific loading, but you wouldn't just jump from 0 to 100. You would work on slowly building tension, all right, in a way that allows the client because when you look at research around movement, and especially the lower limb muscles, from a maximal voluntary contraction standpoint, you never need 100% of the client's maximal voluntary contraction. But the muscles around the lower limb actually operate at a 30 to 40% of their maximal voluntary contraction. So they don't need to be strong, but they need to communicate well. That's the key. And so you always have to work on the coordinative aspect, as opposed to building strong legs. Work on building good coordination between the tissues that allows you to dampen stress and dissipate stress well. And that's really what's going to have a big influence. Actually, I can check some questions here. Is this related to all lower limb pathological conditions? Yes, all these principles that we spoke about all relates to any kind of lower limb pathology, right? Because again, we know that pain in the absence of any kind of tissue damage is just protection from the nervous system, all right? And the rest of just... Okay, those are the same questions. Can you please show some references? Yes, I can send you on some references. I can send them on to the Learnovate guys and have you take a look at some of these things. And it all comes back to how your body's managing stress, right? Typically, there's a lot of research to show that with even running, with jumping, with walking, the first things to switch on, the first muscles to activate are your biarticular muscles, right? And these muscles have been shown to work under isometric conditions much better because they're long muscles. So if you have a long muscle like the hamstring, it wouldn't make sense that muscle has to shorten and lengthen very much. So it works better when it isometrically contracts, and it can take advantage of the passive tissues that connect to it. Same thing with the gastrocnemius. It's a long muscle, or sorry, it's a short muscle with a long tendon, right? So it shouldn't have to shorten and lengthen. It wouldn't have time to do that when it comes to movement. Just because of the example, what kind of language cueing perspective, what sort of instructions would you make sure they're using the calf symmetrically? As long as they're engaging the transverse arch of the foot, the metatarsal heads, I know that they have to engage the gastrocnemius. They have to, because that's what plantar flexes the foot, especially when you engage the forefoot rocker, when you engage the transverse arch and you move from the heel towards the forefoot. So I wouldn't say you need any specific cues, but you need to set them up in a position. I'm of the perspective that you shouldn't need to hyper cue your clients, but when you get them into the right position and you have them just build tension through a specific part of their body, the right muscles will start to do their job and they'll start to contract. Right? But it's all about how you set up your body. So we'll do a lot of supine work first, and then we'll progress towards standing activities where we're still trying to look for those, to express those similar properties. Right, so it's just about more so getting them into the positions. But exactly, the positioning is important. You get them into a position where subconsciously they have to do all the work. Because if you get them into a position and it calls upon the muscles to do the job for them, then that's going to have more of a learning effect, as opposed to you as a client or as a therapist saying, do this here, do that here, I want this here, I want that there. You're kind of straitjacketing movement into rules. When you use too many rules with movements, they're not going to hold on to that change when they go out into the real world. Right? So the positioning is important, and that makes it easier. Exactly, working with constraints. Right? Use the constraints, use the individual's positions, use the environment. Right? Give them a different task to do. Right? Once you can manipulate those constraints, it's going to have a much bigger influence on their movement potential, and it's going to make your life a whole lot easier when it comes to rehab. Because when I first started treating clients, and you first come out of school and you're thinking of all the things that you need to check with the lower limb, I have to check so much, right? I don't know what to check. But once you have a framework in place and you can understand what are the essential things that need to happen, right? And then you already know, like you on your schedule, you know clients coming in with lower limb based issues. You already have an idea of what you want to check, because you've respected the way the whole body works together, right? And so it makes this easy. It decreases the stress on you as a therapist. That's the key. Any exercise equipment, I would use like a step sometimes to allow them to be able to lift their foot off the ground, get an angle at the knee, and press through the transverse arch of the foot initially. Yes, so I wouldn't use any kind of bands or anything like that, but I'd use kind of steps, a 6-inch step initially, when trying to get that gastrocnemius to do its job. To use, yeah, and once you can do that, but it's more about manipulating gravity, like you said it. Get the body into a position where they can manipulate gravity. Not enough therapists do that. We all look for the bands, we all look for the external weights, but gravity is there, and that's going to help. When you get someone into the right position and you use gravity to your advantage, you're going to be able to load the right muscles. All right, so use gravity to do it. We put an awful lot of emphasis on that when it comes to our IKN courses, and it can really, really help simplify the whole treatment process, and especially the assessment process as well, because there's many ways you can assess this. I know I gave you a couple of ideas, but again, when it comes to the assessment, you're just gathering information. Gather information, and you think of strategies that you can use to, you essentially identify what the client's missing. That's what the assessment's all about. What is the client missing? What qualities are they not able to access? And then it's my job as a therapist to allow you to restore those movement qualities. But I think that when you look at the bigger picture of what the whole lower limb has to do, then you can have more of an influence, because those are the big rocks. Like, just because you get a little bit of movement back into the calcaneus doesn't mean that the pain is going to be gone when they get out into the real world. But if you look for what needs to happen for that limb to dampen stress well in the real world, you're going to have much more of a chance of facilitating long-term change, right? Because I'm sure there's many people out there without knee pain, without hip pain, without foot pain, that have lots of these restrictions in their joints, right? And so we look for these small little details when it comes to lower limb rehab, but we have to remember that people without knee pain might have those restrictions too. But a lot of us, and this is based on from what I've seen from a clinical standpoint, and my partner Kyle over in the US, who's treated an awful lot of athletes as well. Even athletes, some very good athletes, don't have the ability to express these qualities, these preflexive qualities, when it comes to the lower limb. All right. Exactly. Gravity is always the best aid, because again, like if you can allow the client to manage gravity, instead of saying you need these bands to take home with you to do their homework, what do you think they're going to do? They're probably going to do the things where they don't need enough or as much external equipment, and so you're building compliance in that manner as well. Right? The less equipment you need to use, I think, the better, because it shows the client that, hey, all I need is my body. I'm not dependent on anything else, you know. But these strategies get the client working as well. It gets the client feeling change and knowing that they're doing something, right? Do we work on stamina and strengthening? Yes, you can work up to that, right? So I would start to make sure that they have these qualities first. Make sure we communicate to the client that, look, we need to work on these things first. Make sure you have those qualities, and then we need to build maybe more, add more variables to it, to work on that stamina, to work on that strengthening. Maybe we eventually get to the point where we add external load. Maybe we get to the point where we add more time under tension to work on that stamina. Exactly, right? And so it's important from a standing standpoint as well. Can they allow the lower limb to do its job, or are they just kind of hinging at the lower back to keep their body weight upright against gravity, which is not a very efficient way. It might be efficient for maybe a couple of minutes, but if you're doing that for 8 hours a day, like you said, it probably might not be the most energy efficient way, right? Great. Missing component then helps to zero down on the problem area. Exactly. And I've seen many times as well is that if somebody lacks maybe some internal rotation at the tibia, which is important, then if I do some of these if I load these preflexive qualities and these biarticular muscles, I go back and I find that the tibia can actually move a little bit better, because you have to think about the why. Like, why is that tibia not moving? Maybe there's a lot of tension around that area because the nervous system knows that you can't express those protective qualities. So the tone is there as a protective response. How do you take into account how pain changes tone? Sequencing for this preflexive mechanism. Does it matter from your perspective? I don't try to, when it comes to rehab, I don't try to work too hard to find the reason for pain. Because in a human being, a human's so complex that I don't think you'll ever be able to find the root cause of pain, if that makes sense. Because you're so dynamic. There's anything you can do it. And that's why I would always say, okay, there's pain in an area. There's just protection there. That's all I think. There's protection there. I'm thinking, okay, there's protection there. Maybe why is there protection there? Maybe I think about the tissues that need to be able to express load well so that there's not the need for protection there. Because when I see a client with pain, I just think, okay, the nervous system has felt the need to do all the protective work for you, right? Because it has made the estimation that your body doesn't have the ability to do that, right? So I don't think the sequencing of how pain changes tone, or was it tone that came first, then pain, or pain changes tone? I think it's all the same thing. It's just protection. It's just a need for protection. Because I think when you can look at it from that perspective, it can model your thought process as well, right? But there's so many things that can change pain and the need for protection. But I think when you have a clear framework in your mind, it can build confidence in yourself, but also it can give you clearer strategies to work towards. How about kinesiotaping as an aid to therapy? Absolutely. So I still use that as well. You can use kinesiotaping in combination with this work. Because again, if you're putting kinesiotape on an area, you're allowing for better quality feedback, sensory feedback from a certain area. So even that can reduce the need for protection. So when you merge that would be an example of what I would think is like a kind of a small detail. Like, where do you put the kinesiotape? You might put it over the area where there is protection. And then you go from there into getting these biarticular tissues doing their job much better. Then you go into your loading strategies, right? Because all you're doing is you're reducing the need for protection. So let's say your thresholds here, if you're in pain, this is your protective threshold. If you're in pain, you're above it, right? If I just put kinesiotape on someone and I help their pain, maybe I bring them back down to here. But it doesn't give me a lot of extra wiggle room to manage more stress. So maybe they walk outside the clinic again and then they get stressed again and it kicks them off. But maybe if I use kinesiotape, it brings them down to here. And then if I work the biarticular tissues, it brings you down to here. And then if I work the other preflexive properties, these protective mechanisms, it brings me further and further away from that protective threshold. So I've just created a nice big buffer, a robust buffer for the client to walk and manage other stressors before they have pain again. So you want to get the client as far away from this protective threshold as possible. Because just because the client has pain in anywhere, in any body part throughout their life, it doesn't mean that if you as a therapist have helped them, it doesn't mean they're never going to have pain again. They might have other types of pain throughout their life, and that's just being human, right? You're going to have extra stress here and there, right? And so we want to look at many layers to help create more influence. All right. Hopefully that answers all your questions. And I think it's important to know that what we're trying to do at IKN is kind of allow you to merge this with your current approach, right? Kinesiotaping, the mobilizations, the manual therapy is really, really, really important. But I think if we can create a framework and a model as to how we can merge these things together and create a more clear sequence for rehab, it can really, really help. It can really create much more influence. All right. Thank you so much for listening. Hopefully you enjoyed, and hopefully we'll have the chance to have a live course very, very soon once we're finished with this pandemic. Hopefully it'll be sooner rather than later.
Thank you so much, Dr. Rand, for the amazing insights on the lower limb pain rehab. I hope everyone has enjoyed listening to you, and we look forward to have their participation in the course so that they can learn more about it.
Absolutely. Absolutely. All right. Thanks for having me. It's been a pleasure.
Thank you so much. Thanks again. Take care. Bye.